program or initiative, then you're never going to really understand your outcomes and exactly how to interpret them, no matter which direction those outcomes are. So even if you found some positive changes in your participants after participating in a mindfulness program, but you did realize that, most of those attendees only attended, 5 out of the 10 sessions, that's good process information for you to know that, well, maybe a 10-week program is too long. Or maybe had they attended all 10, they actually would have even looked better at the end of the program. Their outcomes would have been more improved. Or maybe we only need 5 weeks to deliver this program because their outcomes are pretty good at the end of 5 weeks. That process information helps you interpret your findings. So you need to add some of this into your evaluation plan. You also need to think about, can I add some outcome data? I said earlier that at least, in psychological kind of understanding of mental health and addictions, we're not very good at collecting outcome data in the community, at least. And I think it's even sometimes harder on campus to collect this information. This is really about, did the initiative achieve what it was supposed to achieve? This is really done typically at the conclusion of your program. And this is about the changes that you're going to see in your clients or individuals. It's about the effects. It's how we call impacts. Did that program have a change on a particular outcome? This is much more difficult to collect. In large part is because sometimes we don't always know exactly what outcome we're interested in looking at. We don't know whether our mindfulness program is reducing stress, or improving relationships. And so if you don't always know the purpose or the goal of your program or initiative, completely, it is sometimes very hard to then figure out, well, what is it I'm supposed to measure? And the other thing is that, in the outcome measurement world, you can't be making up your own questions for the most part to really assess outcome. As much as we can use a standardized approach to measuring outcome data, we have to kind of do that. And there's really just a lack of consistent outcome data, a lack of technology that doesn't actually allow us sometimes to collect outcome data. And just a lack of standardization, really. So as much as it's difficult to collect this, even if there are 2 or 3 important outcome measures that you can incorporate in your evaluation, this is really important. And finally, I want to share something about developmental evaluation. It's not really a type of evaluation. It's been described as like that classic road trip. So if you have a destination and a planned route that you're going to take, but you have a very adventurous spirit and you're willing to deviate from your destination, this is what developmental evaluation is. And it's really important in clinical settings because in clinical settings, things are very dynamic and things need to change and you need to learn from what's working and what's not. And developmental evaluation, you put that lens on top of your studies, it allows you that flexibility and adaptability to change things along the way that makes sense to change things. So let's say, for example, I'm administering a paper and pencil intake. Every time somebody walks into my clinic, they're getting this intake form and it's asking a whole lot of questions that's important for me around, the presentation of concerns. Maybe I'm asking questions around, have they, been to my service before? Things that are important at the intake level. And I'm finding that at the paper and pencil level, there's a lot of missing data. Like people are just not interested, especially students. They don't want to, complete an intake form when they come in. So in a developmental evaluation, I would look at that and think to myself, okay, something's not working very well here. Let's switch to an electronic means of collecting intake data. So let's give them an iPad when they come in so they can complete that. And I am finding that that iPad is working much better. Now, in a typical research evaluation, you wouldn't change the modality upon which you're collecting data. Like that would introduce some sort of bias. We don't typically do that. But developmental evaluation allows you to be a bit more innovative and mindful and strategic around those strategies as it makes sense for your organization and your study to actually do that. So learn as much as you can about developmental evaluation, because at least for young people that we're working with, it is a much more meaningful way to collect and design our studies. So now you have a really good understanding of what program evaluation is and what it isn't. And you're going to kind of think about whether that's what you're doing or not. And you now understand that there's different types of designs that you're going to have to, determine, am I doing a process outcome? Can I use some principles from developmental evaluation? Now you're ready to get to stage 1 and stage 2, where you're going to start to plan and map out your evaluation plan. And this is like the roadmap. As I said, I often tell people that I'm working with, we need to put this on paper and pencil or computer and Google form, whatever it looks like. But you can't enter into the process of an evaluation without actually formally planning it out, just like you would plan out anything. If you're writing, for example, a report, you usually have an outline and you start to draft what that report looks like. Or if you're, planning a dinner, you start listing what you want at that dinner. And I would say that an evaluation plan is exactly that same way. It gives you a really structured way on what you're going to do for the course of that destination. And I'm really curious to hear some ideas on what's the first thing that you do when you're planning or mapping out an evaluation. So you can unmute yourself, and Chris is going to probably facilitate.
Yeah, I was just going to say, if anyone wants to, within the raising hand function, or if you want to just sort of get on your mic and chime in. I mean, I'll try to get to as many people as possible, but I'll keep an eye out for if anyone's going to put their hand up first and foremost. And if not, just feel free to jump in. I can see Lynn, I see your microphone is unmuted. Is it because you want to sort of contribute a response here?
Sorry, I didn't know that my
okay, no problem.
But I guess before planning, I would kind of try to decide what would be my expected goal I want to achieve with the evaluation, to see the end, try to visualize the end of the work I intend to do.
Thank you very much, Lynn. I see a comment in the chat from Nicole Daniel, and she's saying, figure out what the stakeholders want / need to know about the program being evaluated first. Brigitte, you're saying a logical framework. Wondering if you could maybe elaborate on that a little bit. Okay, so by crafting long, medium, and short-term goals. Stephanie Chung, you're saying thinking about the timelines and scope, what's reasonable to accomplish, what sources for data stakeholders I have access to at the moment. So it sounds like a lot of like armchair quarterbacking and looking at potential paths. I really resonated with figuring out what the stakeholders want and need. And I remember from doing a lot of projects, like it's like a moving dartboard that you're trying to constantly figure out what that is. And I just, sorry, Stephanie, football analogies are not for everyone, I agree. I'll keep an eye out for some more, Deb, but if you want to take it away, I'll potentially interrupt you, if anyone else has chimed in with another response.
Thank you. I didn't mean to have my notes on that page, but So thank you for some of those suggestions. It sounds like you do have a process in place, which is great. That doesn't always happen. So I'm glad to hear that you are planning and mapping out an evaluation with some really critical components to begin with. So I usually combine stage 1 and 2 together because I find that there's lots of overlap and similarity when it comes to planning and mapping out my evaluation activities. So I'm going to share with you my 4 non-negotiables for steps in planning my evaluations. I'm going to talk to you a little bit about each of these because I find that when I really plan these things at the forefront, I can not only, provide a better structure and framework to the work that I'm doing, but it can be very transparent for everybody I'm working with. So the first is determining the why, deciding on what design I'm going to use, deciding on my questions, and then thinking about measurement and data sources. Whenever I'm doing these first couple steps in mapping and planning, I would never recommend doing any of these steps alone. Even if you've been charged with working on evaluation in your department, if you're funded or non-funded to do this, it doesn't make sense to develop your evaluation plan alone because the most richful, information that you gather are from the people that are involved so closely sometimes with the program you're trying to develop or the initiative that you're trying to evaluate. And so from so many perspectives, not only from a buy-in perspective within your department, but if you can sit around the table with a lot of different people at different points in time during this planning and mapping and say, why are we doing this? Are we doing this because our leadership wants us to do it? Are we doing it because the funder has said you must evaluate this? Are we doing this because we really need some data beyond what we think or that gut feeling? To answer some questions, some real questions, whether we should even continue delivering this program. Having an understanding of your why and communicating that why internally to everybody is a really important process, not only from a buy-in perspective, but in also engaging everybody to be part of this new culture that you hopefully want to instill within your departments, that evaluation matters and we need to prioritize it. We need to be able to do it. And you need everybody on your side to make that happen. So when talking about the why of the evaluation, why are you evaluating this program? Like, I really think that, as I said, during this pandemic, when we're already so busy, we're always on Zoom, we need to really think about, why am I doing this? And what do you hope this evaluation is going to be able to answer for you? We don't just, collect information just for the sake of collecting it. There's too much time and processes involved in collecting data that isn't going to actually inform our decision making. And so think about what the why is, communicate what that why is, and have other people, answer this why for you. And everyone can have a slightly different approach to why, the evaluation is important for them and for their department. And I think when you know the different reasons, you can then start incorporating perhaps different measurements based on some of those reasons. So if my why is about, well, I want to know whether this program is actually effective in reducing anxiety, but somebody else's why is really about, I want to understand, the delivery of this program, and do we need trained facilitators, and do we need it to be 10 weeks, and can we improve retention in this program? That's a different why than an outcome type of why. So always keep in mind that this is going to be an important part of that first step in mapping it out. And it needs to be intentionally, and I recommend that you write it down and share it so that everybody is very clear at the forefront about why you're doing what you're doing. Because I've heard over and over again, not everyone buys into evaluation in the same way that we do, and not everyone supports it. So having this very clearly communicated is a first step in that. The second is you need to, decide on what your evaluation design is. Now, I teach a course in evaluation design, so I know that you can't possibly understand, or I can't communicate this all in a webinar about how important this step is. But I think we really need to be very clear on what our design is going to be. And I try to simplify this as much as possible. So to me, especially on campuses, what I've seen the most is these 3 types of designs. So you have the opportunity to do a post-only evaluation. In a post-only evaluation, you're collecting things in one point in time, and you're collecting it after it happens. So if, for example, I'm implementing a DBT program, I had no opportunity to collect any baseline data. I didn't get to see anybody before this program started. I can only collect information at the end of that program. That is a post-only evaluation. They're listed here in the order of, I would say, strength. So post-only evaluations are probably the weakest type of evaluation you can implement because you're collecting data in one point in time. You can't say a whole lot about outcome data when you only have how they look like at the end of your program, because you have no idea how they look like at the beginning of your program. So, you know, is it something that I would recommend that you always implement? No, but lots of times that's all we have available to us. Now, if you're implementing a workshop, for example, and let's say it's you know, a workshop to improve leadership skills, you might only think that a post-only evaluation is really only what you need at this time. I only want to know that they, you know, enjoyed being at this workshop, that they learned some things, that they were satisfied with it, and so you're going to stick with that. Again, it really is dependent on why you want that data and what you're going to do with it. The second one that's even better if you can do it is the pre-post. So very similar at the pre-level, before your program has been implemented, you have baseline data on the same things that you want to measure at the end of the evaluation. You have that post-level data. Pre-post is a much stronger design because now you have 2 points in time and you can look at things across time, right? You can collect their information prior and post. Now, is it, you know, the strongest design? No, because typically we don't have control groups where they're not getting a program or an intervention, and that would be even stronger. But a pre-post is much more stronger than a post only. So if you can implement that and you're able to collect baseline data prior to the implementation of your initiative, you want to collect some baseline data. This gives you more confidence in your findings at post. It can make your data more reliable and valid at post because now you have some pre to compare it to. And finally, if you have the opportunity to follow up with young people or clients after they've, you know, received a service, this again is an even stronger evaluation design. Now, I know that the resources sometimes are not worth the extra data we get in follow-up evaluations because, you know, I try to include a follow-up all the time and I lose a lot of people along the way. And you take a lot of time and money to actually follow up. But what we do know from a lot of our, you know, psychological literature and program evaluation literature is that a lot of the improvement that we see post-program or post-initiative or post-intervention is not often maintained at a follow-up period. So at the end of my 12-week DBT program, trauma symptomology had decreased. My young people felt more confident in their relationship skills. They had, you know, better, you know, self-efficacy scores, and they also were better able to communicate and regulate their emotions. When I follow up with them 6 months later, all of those really positive effects actually disappeared. Their trauma scores look like they did when they started the program, and they're still struggling now with their emotions. So we know that that does happen, and lots of interventions have sort of implemented sort of booster things along the way to alleviate some of the loss that we get over time of those effects, but we don't know that unless we collect data. So if you have the opportunity to collect follow-up data, it makes your findings even more and your data even more reliable in terms of being able to say, hey, like this program is actually pretty effective in that it allows for a long kind of standing learning or knowledge or change. Again, you know, there's lots of nuances within these designs. I'm simplifying them as much as possible for you to think about what can you have the capacity and feasibility to do within your department. A couple of timing things when it comes to evaluation. You can think about just a one-time evaluation that's related to a special initiative or project that has funding specific. whether you have a student that's very interested in doing a project that needs to be done. This is very common, and it's what we do all the time. Does it require a whole lot of resources? It may not require a whole lot of time or expertise in doing it. So again, think about it when you're planning and mapping out your evaluation. Does the one-time evaluation make sense? If you have more resources at your disposal, if you have a bit more time, you can actually do something that we call an intermediate evaluation, which allows you to measure some things that are important to you in the work that you're doing. You can identify barriers with the implementation of that program. You can use that data in the moment to improve your program, and then you remeasure it. So this is the cycle of evaluation from a program evaluation perspective that we really care about. This is what separates program evaluation from research. It's very similar to quality improvement. This is what we do at a quality improvement level. We measure some things, we might change our activities, and then we try to see if we've improved our standards, and then we measure again, and we keep doing this over and over again. So this is more common from an evaluation perspective to give you more information around what works and what doesn't work, and whether you're able to actually see some changes in your clients over time. And then if you have the capacity to have like dashboards of data, whether you have an ability to collect data on an ongoing basis through electronic health records and some more high-tech kind of technology, then you'd be able to implement sort of more of an advanced approach to that design. Again, it really depends on the capacity to be able to do this. The next part that is really critical in mapping and developing, and part of the success of your evaluation is really going to come with how you're crafting your evaluation questions. And often I have to remind people that I'm working with, when they tell me, Deb, can you help me with this evaluation? Okay, great. What sort of evaluation questions do you have? And they haven't really thought through what that is. And in large part is that they don't really kind of know where to start with that. They have some broad thinking about what they want to evaluate, but they haven't been able to clearly, concisely, specifically develop a question that their evaluation is going to answer. And this is a really important process that has to be done with everybody around the table, because everybody is going to be able to contribute to different parts of that evaluation in a different way. So the first thing I always recommend to people is that you have to define the program. You have to understand what the goals of your program are, or the purpose of that, in order to really articulate an evaluation question that is going to be able to be answered by your evaluation. If I don't know that my DBT program is supposed to reduce trauma symptomology, then it's really going to be hard for me to have an evaluation question that's going to be answered in a reliable, kind of valid way if I don't know what the purpose of that program is. Is it to reduce wait times? Is it to improve some sort of psychological outcome? You have to understand that, and it takes a lot of time to define these evaluation questions. And the other recommended thing, and I hear this a lot, is that sometimes there's just too many evaluation questions. And I always say to yourself, less is sometimes more. And if you can prioritize 2 to 3 really important ones, at least for this period of time, then work with that, because this is what really underpins your work. And if you don't take the time here to develop an evaluation question that is really pertinent and important to the goals and purpose of your work, it's just going to, again, be a lot of wasted resources and time. So I have a poll question here, because I'm very curious around your ideas on how you brainstorm evaluations. So before embarking on your evaluation, do you brainstorm evaluation questions based on the program's goals and purpose? Does everybody see this poll? Yes. So some of the time, hardly ever. getting everybody coming in. Okay, I'm going to share those results with you. So each and every time we're seeing 31%. Some of the time we're seeing 46%, and hardly ever is 23%. So I've never done it this way. So again, you know, I think there's lots of variability in the way that we brainstorm evaluation questions. I'd love the opportunity now to open the floor to hear about your process involved in selecting evaluation questions. What are some of the, you know, successes you've had in doing that with some of your projects? What are some of the barriers that you have faced when developing an evaluation question, and do you think this intentionally about them in your evaluation? So I'm going to just close this poll. Happy to open the floor or the chat box.
I'll keep an eye on the chat as I did last time, and bring any comments directly. But yeah, if anyone wants to jump on the mic and chime in, we welcome the responses. And we also had a previous answer from Melissa Fernandez to the previous question that relates to this one as well. And she said, I try to figure out places within the program that I can gather data from. Sometimes this allows me to gather data I never thought was even possible.
Yeah. I'm assuming, Melissa, you mean like already collected data sources that you might have collected within the department?
No, I think I was actually talking about, like, I look at different places within the program design to see, is there anything that we can learn from maybe people's participation in a certain component of it? Or is there a way that we can see like other points of data that are more creative rather than like a survey?
Right, absolutely.
We got another comment from Janine, who said, we always add learning outcomes to an evaluation mapped onto the learning objectives outlined in the program being offered.
Great. So I'll be curious to know whether once we get to the measurement part of that step, how easy it is to generate some measurements based on your learning outcomes and objectives.
Kate McIsaac, include students in the evaluation and use language that they are familiar with.
Yes, absolutely. That goes back to our, creating, meaningful evaluations for the people that we're collecting information from. There's I don't know if you're familiar with the concept of measurement-based care, but there is a big push, and there always has been a big push in healthcare at least, but now more and more in mental health and addiction services, implementing measurement-based care, which means that the information that you collect from the individuals you're collecting with makes sense to them, it's meaningful, but you share it with them in a way that they understand. And then you use that information together with them to develop a plan of care. So, we tend to collect a lot of information from our clients, but we don't always share it back to them. And finding ways to share it with them that makes sense to them, and then being able to together kind of inform a plan of care based on that data. So measurement-based care is something that we're seeing a lot more in clinical settings, so that you can engage your clients in that information. Okay. Thank you. Let's move ahead here. So I'm going to show you how I generate my evaluation questions based on an example that I've just generated here. So let's imagine that you have a peer mentoring program, and it's a voluntary program for first-year students where you're trying to get them to come to 2 hours a week for 8 weeks, and it's training in semester 1. And really the goals and purpose of the program are about improving their relationship skills. You want to connect them to resources on campus. You want to better prepare them to support their peers, because we know that everybody turns to their peers first. We also want to increase student retention because we're seeing that we're losing a lot of first-year students, so this might be a way to do that. and we want to improve self-efficacy, confidence, and well-being. So together with my team, I generated these 5 different goals and purposes of the program. And this is the first step in trying to generate an evaluation questions for your evaluation of this program. So knowing this, does anybody want to perhaps suggest what an evaluation question they would prioritize for this peer mentoring program? If you had to develop an evaluation question, what would it be for this program? Does anybody have any idea or want to share?
I was just going to say, in regards to the goal number 2, connecting them to resources on campus, some type of a knowledge awareness type of question around their ability to know exactly which resources are available to them and how to access them through their own means, rather than like, where do I go for this? Who do I talk to? That type of thing.
Yeah, so some sort of question around, their awareness. Has this program improved their awareness of campus resources or their knowledge? Okay, I'll just go ahead here. So I'll tell you some of the example of evaluation questions that I've generated and how I kind of divide them up. So first, I always put together my process evaluation questions, because I told you before, this is a really important part in understanding whether our program is having the intended effect that we want it to when I start to collect some things about the process. So some of my evaluation questions are, was the program implemented as intended? So I'm going to have to figure out, okay, how am I going to collect information that's going to answer this question? Who are the participants that volunteered for this program? I need a good sense of who they are, in terms of demographic information or other information that could be relevant. How can implementation of the program be improved? Again, as I'm generating these questions, I'm starting to think about my measurement and my data part, because I can generate, 100 evaluation questions, but I don't always have the measurement tools to answer them. I don't always have the feasibility to answer them. So only generate those evaluation questions that, first of all, in a timely manner, you're able to answer. Now, let's say, for example, you didn't have, the feasibility or the timing to collect an evaluation question that you really needed an answer to. You're going to have to think about, is there something else I can do that can help me get some of that data without going through, let's say, a much longer process. So, we have to sort of prioritize what we can answer and what we can't answer, and just, recognize at the end of our evaluation that there's a lot of other things we don't know about this program, and maybe in the future we can kind of look towards a more rigorous or more longer term evaluation. But again, putting them all in the process column for me is really important. And then I put everything in the outcome column. So my outcomes are, does participation in the peer mentoring program improve student retention the first year? So I'm starting to think, okay, I got to measure student retention. How am I going to do that? Does participation in the peer mentoring program improve student confidence in accessing support? So Chris had said their awareness. I'm interested in looking whether they feel more confident. There's a bit of a difference in awareness versus confidence, because when I'm measuring confidence, I might have to think about how I'm framing that. Do you feel more confident accessing supports on campus versus are you aware of? Again, that gives you a different understanding of, the impact of that program on their awareness or knowledge or confidence. And does participation in the peer mentoring program improve relationship skills? Now, that's a pretty general evaluation question, and I have to think about, how am I measuring relationship skills? We know that the best way to measure relationship skills is probably to actually watch them, interact in real life with their peers or with an adult of some sort. It's really hard to measure relationship skills on pen and paper effectively and accurately. So again, another thing that you need to think about as you're going through your evaluation questions is, how do I reliably collect this information in a valid way? And if it's relationship skills you're trying to collect information on, that's going to be hard in paper and pencil. You can, somehow generate some sort of questions to get at whether they've improved their relationship skills. But again, I think it would be a pretty, mediocre approach to that. And so I might knock that question out because I don't have the capacity to, watch them or have them come in and, have a conversation about their relationship skills. I would probably say that, these 7 questions are even too much for me to include in an evaluation of this program, because you have to understand that each of these are going to require a data collection process. And you might be able to do it all in a survey, but maybe you have to have a focus group or an interview, and all of those layers add a lot of extra time that you might not have. So, prioritize 3 to 4 of these that are most important to help you inform your decision making about that program. And then if you have extra time, then add some more. We just don't add evaluation questions for the sake of adding evaluation questions. Just some general guidelines for when you're writing them. If you think about, being very specific, like the SMART analogy around, being very specific and clear in a very timely way, this is how we want to have our evaluation questions. Absolutely, the number one thing is it has to be measurable by the evaluation. You have to have a way to assess this outcome that you want to assess, or this process that you want to assess, and it has to be feasible. And I would say that your evaluation questions, sometimes at the beginning of the planning and mapping stage, actually become more refined as you go through your evaluation. And are you allowed to change them along the way? Well, in a developmental approach, you're allowed to refine them, absolutely, because that's what makes most sense. So don't, just do them at the beginning and then don't ever look at them again. Continuously try to revamp them so that they're specific and very clear, and are really about the purpose of your program or initiative that you're trying to have answers for. So are you all still with me? I hope so. It's hard to tell when you're just looking at your screen. So it is 11 o'clock exactly. What timing is? That's great. So I'm going to give you all a 5-minute break to kind of stretch and do whatever it is you need to do. And then we'll meet back at 11:05. Thank you.
Great points you're making, Debbie. I'm loving it.
Oh, thanks, Maria.
And yeah, sorry, Deb, earlier with the polls, for some reason, all of a sudden when we started going, when I click on mine, it just brings up a screen that says I'm logged in from another device and polling is inactive. So I can't actually see anything with the polls. I can't even see when people are responding, but I've checked my breakout room function and I can still do that. So I have no idea
That's
how that
interesting.
got taken away. Yeah, but I'm glad that you're still able to see it, because don't really know what happened there.
Okay, it's 11:05, so hopefully everyone had an opportunity to get up and stretch. I've been reading some articles about the pains that everybody's feeling from sitting so much in virtual meetings. So I always make an effort to move around all day long if I can. And Chris just told me he got a standing desk, so everyone's trying to do their part in maintaining some, healthy posture and body awareness as we sit in our virtual meetings. So the final step, well, I don't want to say the final step, but I remember I told you these are my 4 non-negotiables when it comes to mapping and planning, and I never do these alone. This is one of my final steps, and it's, I think I said arguably the evaluation question is the most important. I take that back. I think the measurement and data sources is actually most important. There is an expression that is attributed to a lot of different sources that says, that which is measured improves. And this is not to suggest that measuring something is going to lead to automatic improvement, but rather it underscores that the right data must be collected in order to measure whatever it is you are interested in measuring. It is a challenging step. It is going to require some knowledge around your program goals and around the theory of measurement. I don't want to minimize this step because, believe it or not, you can actually get a PhD in measurement. There are people who do measurement for a living, especially like in the social sciences and in the psychological kind of, the psych area. So it is an important step, and it's not something that's going to necessarily come easily. But the better that your measurements or assessment or your data is, the better your evaluation. I mean, that's just going to be a non kind of thing that you have to always understand. And I put garbage in, garbage out here, because if all we're doing is generating a few questions that we made up because we think that that's the way to collect that data, you're probably not going to get what you want out of that. So as good as your measurement is, that's going to produce, a better kind of result at the end. Not to say that your program's automatically going to be amazing. That's not what I'm saying. What I'm saying is that you really have to know that what you're measuring is what you think you're measuring, and that you're doing it insofar as you can use a standardized tool to do it. That's what you want to do. There's lots of tools out there that have been published, that have been tested on multiple populations to assess a variety of outcomes that we're mostly interested in. And they're free to use. So insofar as you can use those standardized assessments, you want to go out and find them, because those are the ones that we know, those are the ones that test general health. Those are the ones that are testing, just stress levels. And those are easy to score, easy to interpret, and we know what they mean. You don't want to get into the habit of necessarily making up your own measurement and data sources, because those won't be really reliable and they may not actually be valid. So in planning your measurement for your evaluation, I always go back to my evaluation question. So I just chose one of these right now. And the question, does participation in the peer mentoring program improve student retention in the first year? So what I usually do with my partners is we go into a brainstorming session to say, okay, what are all the possible ways that we can measure student retention? And you would think about the feasibility and the accuracy and the validity of all these different possible ways. So one of the ways I thought about is, well, we could just ask them. So we could email them a survey at the end of the school year and say, hey, are you still coming to class? Or are you still registered in school? Or we could, email them during second year and see how retention's going, or call them back into the clinic and kind of do a little interview. The problem with that approach is that it's still self-report. So, maybe they're not going to totally tell you the whole truth. But it's also the case that you might not be able to find them, or they might not return your emails, or they might not do your survey. And that doesn't mean they've dropped out. It just means that they don't care to actually complete your data, or they never got your email in the first place. So there's a lot of holes in that approach. So if I were sitting down trying to brainstorm, how can I measure student retention? That wouldn't be the top of my list. If I could access official student record data, that would absolutely be the top of my list, because this it's much more feasible. I can probably go into the computer, I can look up all the names of who was in my peer mentoring program, and I can see, did they register for year 2? You know, just because they're registered doesn't mean they're actually coming. So again, you have to think, well, that measurement actually has a bit of holes in it. But, you know, it's better than just asking them or sending a survey. So again, these are the ways and the strategies that I use and that my team uses when we're trying to think about measurement. And it's not an easy task, but you would essentially do this for all of your evaluation questions. And this assures, number one, that you're only collecting data that you actually need. What I usually tell my graduate students, because you know they're kind of novice evaluators trying to figure this whole world out, print out your evaluation questions and tape them to your computer screen. And I don't want you to write about, and I don't want you to collect data unless it's related to these questions. Unless it's answering this question, then you're going to actually collect data on that. And unless, you know, it's answering this question, that's what you're going to write about. Because it's very easy in the world of, you know, evaluation to get carried away with reams and reams of information that we actually never end up using. And so it's really kind of a good practice to have those at the forefront of your evaluation, physically in front of your face, but also, you know, in meetings when people are at, you know, brainstorming about this, hey, let's go back to this. This is what we said we wanted to answer. So we need to find a way to measure and evaluate and have an assessment that's going to answer that. So some general rules of thumbs when you're thinking about measurement. First of all, some data is going to be much more time consuming and expensive to collect than others. You know, qualitative data, I love it and I work with it all the time. But at the same time, I'm paid, and that's my field, to work with data. So I have a lot of time to do that. You know, in the settings that you work in, you probably don't have a lot of time to analyze qualitative data. You know, even if you were able to do focus groups, that's quite a bit of time that you need to rigorously look at responses. You need to audio record things. You need to theme your data. Again, there's a big burden in that to collect, especially if you're doing that on your own. Having said that, that narrative piece is probably way more important in telling you information than a quantitative survey is going to ever get. So is there a happy balance? Is there a medium where you can collect some qualitative data that's going to be descriptive and narrative and really tell that story that you want to tell everybody about your program without it taking a year to analyze? Because typically qualitative data takes, you know, much longer time to analyze. And if you don't have students to help you with that, and you have to do that on your own, it's a big burden. Secondly, and I always suggest this, is that, and I know some of you do this quite often, is use existing data sources. So don't reinvent the wheel. You already have a lot of intake data, especially for those of you who are working on or who use electronic health records. You collect a lot of information from clients at intake. Is there any of those data sources that can help you answer your evaluation questions? Maybe, maybe not, but that is a possible way. I know in a lot of clinical settings, there's sometimes exit surveys that are given, and that's another way. Can we use some of that data that's already collected? That will save you some time and resources, as long as they're good enough, they're valid and reliable to answer those questions. Assessment that is simple, precise, and measurable is best. And again, remember why you're doing program evaluation. You're doing program evaluation as a strategy to collect data that is going to inform your decisions around that program or initiative on how to improve it, continue it, make it better, all of those things. If I'm not collecting data that is going to be useful for those decisions, I need to really think about why I'm collecting it. And that is why it's really helpful to have those decision makers as part of this process. Because if those decision makers are not there with you, then you may not collect the data that they actually need to inform, you know, whether this program is worth to continue. And I mentioned before the SMART analogy. Again, anything that's measurable and attainable and relevant, you want to try to do. A couple other considerations that I think about when planning my evaluation. First and foremost, I ask myself, is your measurement gathering information answering your key questions? And will my stakeholders agree that what I'm measuring is actually what I intend to measure? Given my resources, is it feasible to gather this information? If I'm measuring psychological outcomes, am I using standardized assessment tools? am I capturing the successes and barriers of my program implementation efforts? You know, I know, and I've been in this situation lots of times where a lot of people don't necessarily want to hear or document the challenges that we kind of are experiencing. They don't want it in paper. They don't want us to share it. I've had this direct experience multiple times. We need to collect that information because that's one way that we can help improve what we're doing. So the successes are important, but so are the barriers, because that's, you know, as you know, the only way to learn is when we learn from the things that are not working. So stage 3 is all about implementing your evaluation. So I'm not going to go through all of these, but I kind of listed all the possible things that you can use and what I do use. Quite often, you know, we do questionnaires or surveys or checklists. We do interviews. Sometimes you can do documentation reviews, so a file review, for example. Observations, of course, not always possible. Focus groups, case studies, other narrative accounts that you might have access to. You know, photos are being used more and more in a way to gather information. So if you implemented this, you know, really cool initiative on campus, you might be taking photos of that initiative unraveling. And over the course of 3 or 4 months, you put all those photos together and you start telling a story about what people are experiencing. Again, that's a very, you know, different approach to data collection, but it exists for you. And this is often more meaningful, and you can call in your students to help, hey, make sense of this for me. So I always encourage a bit more approaches to collecting data if you have the opportunity to do so, and, you know, practice with it. Of course, it's not going to be perfect the first time you implement some of these that you're not familiar with, but it's the only way that you're going to have some opportunity to learn what works and what doesn't work when it comes to collecting data and how you can get better at it. Stage 4 is all about making sense of your evaluation. So how do I make sense of the data that has been collected? Again, you know, do you need expertise in data analysis to make sense of the data in your evaluation? I would say you need some expertise in it for sure, but it all depends on what sort of data you're trying to manage. So comprehending your data that has been collected, especially if it's been collected in many different forms. So if you're using existing sources and you're doing surveys and you're also doing a focus group, you need to be able to work at it and repurpose that data for different audiences. So I never have one presentation on my data for everybody that I'm presenting it to, because not everybody needs to hear and see the same things. Everyone has different needs. You know, my manager has one need, my clients have another need, my funders have another need. And so I really tailor my data to those needs. I also note, you know, that sometimes, you know, when I reduce all of my work into an infographic, for example, that can be very meaningful and powerful for lots of different audiences. And even though I feel like, oh, you know, this was a year of work and now it's, you know, reduced to 3 slides or 1 infographic, it's not about me. It's not about all my work going into 1 paper. It's really about that essential skill of transforming that really powerful information, summarizing it and repurposing it for different purposes. Like, that is a skill that, and an important skill that you need to master to really be able to make the most sense of your data. And that includes, you know, visualization and outputs that are accessible to many different audiences that you might be tailoring it to. And this making sense of your data also requires you to pay attention to data quality. So how can that inform your data collection practices? So as I mentioned before, you know, if you're seeing that there's a lot of missing data in some of your surveys or in your intake, you can look at, is there a way to make that more accurate? Can I make this data collection process more complete or consistent, collected in a consistent manner or reliable manner? So I really want you to think about, when you're collecting your data and then you're trying to make sense of it, I want you to infuse a data quality lens to that. Because the only way that we can improve our quality of data and our collection of data is if we intentionally kind of think about, how is this data looking? Is it complete? Is it reliable? Is it accurate? Is it up to date? And how can I infuse some activities to make it better? And again, because we need this data for decision making, it has a lot of weight in being able to be something that's accurate and reliable and meaningful. Because again, it's going to inform my decisions. I'm making an informed decision based on accurate analyses, not inaccurate. So I thought of some questions that you could ask yourself as you're interpreting your data. Are the results what you would have expected based on knowledge of evaluating data is something that we do every day. I don't want you to think about this as an inaccessible task just because you're not an expert in evaluation. The goal is really to kind of infuse this style of thinking into the decision-making process of your campus. And
Deb, do you mind if I interrupt you for a second?
Yeah.
Your audio, just when you just started those last few points, started to get a little bit choppy. I don't know if it was because you were moving off to the side a bit, or if your microphone might have a bit of a connectivity issue all of a sudden.
Okay, how does it sound?
That's much clearer for me. I don't know, Melissa, I know you noticed it as well. How's it now for you?
It's better on my end.
Okay.
Okay.
Thank you. So again, when you're interpreting some of your data, ask that and ask the stakeholders around the table, because that helps you become very familiar with what you're finding. It helps you make better sense of that. And it's very important in terms of a decision-making process to say, hey, is this what we would have expected? What has surprised you? What hasn't? The next thing that's a really important strategy to kind of think about is the data and the results that you're getting, does it align with any existing literature that's out there? So what does that mean? That means that you're going to have to do some searching on Google, and if you have access to databases that have published articles, you're going to have to go out and read what other people are finding about peer mentoring programs. If everybody is finding that peer mentoring programs improve student retention in first year, and you're finding that too, you can be more confident in your evaluation that, hey, like, we actually found what everybody else is finding, and this is pretty exciting. And also we're finding a couple things that are different, and this is also exciting. And again, as you're interpreting your data and presenting this and using it to inform decision making, it just makes it a stronger argument when you can use existing literature that's been published, and even if it's like the gray literature that isn't published, because not everything is publishable, it can help you and your organization improve your use of that information. So remember at the beginning, like, the utility and the usefulness of my data has to be, forefront. Being able to align it with the existing literature is one of those factors that really helps me. Another one is there another source of data that you can compare the results to? So if you have access to other sources of data within your department that you can kind of like compare the results to in a way that's comparable, use it. It may not be the exact comparison that you need, but it might shed some light on how to interpret this information and what it all means. Again, from a data quality perspective, are you able to identify any potential issues with your data? For example, like, is there any potential privacy issues with your data, limits to how it can be shared, concerns about identifying respondents, staff, or individual programs? So as you're interpreting your data, you need to think about, well, only 2 people identified themselves in my program as Indigenous, which means they're probably identifiable. You'll probably know who they are. Should I be reporting on their data specifically in this presentation if people could recognize who those students are and what their responses are? Again, we typically don't present individual response options, but those are the kind of questions you need to think about. If you have a very small sample size and you're presenting this information, is it still private? And what is the consequences of sharing some of that if respondents now become identifiable? Stage 5 is all about communicating your evaluation findings. And, I find this the fun part. It comes quite near the end, but you really need to think about, how am I going to communicate my evaluation findings so that everyone sees the importance and the use and the need of this? And this isn't, again, an easy task. But here are some things that I do. So as I said before, I always tailor to the audience and find something that is really important. So if let's say the ministry is always interested in improving wait times. Like, honestly, like that's probably the only thing they care about, at least in the world that I work in. So when I do a presentation to them, like, yeah, you better believe that that's going to be the forefront of my evaluation, whether the wait time's improved or not. I'm just going to make it part of that evaluation discussion because that's what they want to know. Do they care about implementation? Not really. So I might do that less. So you need to really know your audiences to know what they want. I always prepare an executive summary of my results because the reality is nobody's going to read an 80-page report. Not to say you're going to generate an 80-page report, but I have seen at the post-secondary level lots of big reports that have been done from an evaluation perspective. And I don't think they get read, and I don't think they get used. So an executive summary that's 1 to 2 pages is brilliant and what needs to be done. If you can do a brief that's like 1 or 2 pages, that's really kind of neat, high level, highlights everything that you found, awesome. Infographic as well. And then I always develop a PowerPoint based off my executive summary, and I tailor that PowerPoint depending on the audience. And then I present the findings to the parties and tailor it as I see fit and learn from each presentation kind of what worked and what didn't. You know, I think there was a time in my career, and Sandra, if you're still on here, you probably, you know, have been in this position too, where you present a whole bunch of graphs and like maybe 20 of them in a presentation, and you realize that you lost everybody along the way. Graphs in a presentation, I mean, unless you're at an academic conference, don't fly over very well. So finding the right balance about the integrity of how you're presenting your findings. So you don't want to minimize them. You have to integrally present them in a way that's meaningful. But you have to understand that people can't process a very complicated, let's say, graph very easily sometimes in a presentation. So is there another way I can do it? Is there another way I can depict it and show it? So that takes some practice, but again, you only learn through the practice and the feedback that you're going to get. And stage 6 is all about using your data. So I probably said this a lot, and I know it's not always easy to do, but using data to inform your decision-making should be your top priority for a program evaluation. And as a sector, we are tackling, you know, difficult issues on very limited resources, whether that's people or money. And therefore, you know, it's really important to build that culture within our departments where we understand what works. We understand what we need to invest our time and money in, for whom, for where. It's even important for us to use this learning to improve sort of the impact of the work that we do, so that we can use evidence to inform our work. And I know we all talk that language. Like I know we all say, you know, we need evidence to inform our decision making. But I think when, you know, the rubber hits the road, do we really use our data to inform our decision making? We can't always. I understand that because some things can't be changed no matter what the data says, but making those better decisions, you know, by learning through data is something that we need to continuously remind ourselves we should be doing, and showing us how to do them and showing others how to do this is important to improve our practices, improve the interventions that we're trying to deliver. It's a way to be more efficient and save time and money. And I think at the end of the day, like, we need to really think about how our data can do that. So knowing that it's not necessarily a linear process, you know, applying data in a critical manner is not easy to do, and it requires us to examine that data with a healthy skepticism, right? We have to move beyond our gut feelings and our, you know, anecdotal information that we might get from service providers to say, hey, like this is really working, to really think about what is the data saying. And this is to me a key kind of skill towards developing a data-driven decision-making culture or framework within your organization. And I don't think that this should be the responsibility of any one person on this webinar within their department. It really has to be, you know, from the top down and from the bottom up, developing that, you know, decision-making culture environment. So this is exactly 11:30 and exactly when I wanted to for us to break out into our Zoom breakout rooms. So there comes great value, and I know this so clearly, and I know it when I do workshops live, where everybody loves sitting around the table and hearing about everything from everybody else and having that opportunity to partner and collaborate and talk to each other. So Chris and I and Maria, we thought that Zoom breakout rooms would be a really important part of this presentation. So we're going to randomly assign you to some breakout rooms. And within this breakout room, of course, you're able to talk about whatever you want to talk about. But what we've generated here is we want you to share at least one evaluation success you've had in the last year, because people can get lots of good ideas from your successes, and also share at least one evaluation barrier you've had in the last year besides the pandemic, because we know that that's really kind of put a halt sometimes in our evaluation efforts. One activity that you're working on from evaluation perspective that you might want some advice on from anybody else in the group, and exchange contacts with one another. You know, there's, I think Stephanie, if you're still on here, you know, you said it would be really great to partner up or have a buddy somewhere along the province who's also doing evaluation that I could, you know, email or call or ask some questions to. So it's always neat to have that opportunity, and CICMH is a great connector in that way. So I'm excited for you all to get into your breakout rooms, and then we'll just come back to ask any questions and say goodbye.
Sounds good. So I'm gonna start the process of setting up the breakout rooms. I think we're gonna do about 3 to 4 people per room.
For you to talk with your groups. I'll just open up the floor in the last 10 minutes if anybody has any general questions they want to ask myself or Chris or each other about anything related to evaluation.
I'd be curious to hear also like what some of the salient points that came up or experiences. I was from the outside looking in. I didn't get to dive into the breakout experience. Were there any big highlights?
I think that
Happy to share a couple quick thoughts. Hi, everyone. This is Stephanie from York University. I don't know, am I coming through audio?
Loud and clear, Stephanie.
So yeah, I had a good meeting with Janine from U of T and Nicole from Durham. We're definitely going to continue the conversation because we don't all have necessarily an evaluation community of practice on our own campuses. So I think that's great. I actually wanted to talk about something that we briefly discussed a little bit earlier about getting data from various sources and how important that is outside of our department, right? And I mean, even within the department, you can talk to students, staff, look at official records. Maybe that's a little bit more objective, right? But then there's also what's happening at the divisional level and what's happening at OIPA, which is the, well, at least for us, right, the university-wide data collection folks. So more recently, we've been having conversations about looking at all the different surveys that are going out to students, because departments are always sending out student experience surveys or other, just needs assessments, right? Gaps assessments. And we're frequently asking the same questions. So that's something maybe to look into at your own organization. If you feel like your capacity is a little bit limited, or you frequently receive something from a colleague that says, please share this with your student, and you're thinking, hey, we should be doing this in our department, or maybe we don't need to replicate that process, but we'd love to get access to that data. I mean, I think that's something to think about. Usually goes by our heads because other people organize all these things and we're not speaking to each other in terms of what the outcome is, right? Or people are even asking, I'll give you an example at York, right? At our divisional level, people are asking about various services, but they might not have the right language to cue into some of the awareness or knowledge pieces we're seeking to understand. So definitely should be co-designed and shared with the responses. Just something to think about.
Thanks for sharing that, Stephanie.
I think you raised a really good point around how many different places on campus are asking for student information and different surveys that go out. And I know Leah in my group was saying, that the response rate when they send out an email survey to students is not that great, even though they're reminded to do it and they're set in session, please do this survey for us, it's still pretty dismal. So looking at ways to improve some of that would be really, really, really critical, because, a low response rate, you have to really think about what it means when, only 10% of people are responding. Is it the really highly motivated individuals who are giving you feedback, and then that's kind of going to be biased, or, you know, is it the people who are the most grumpiest giving you feedback, when you don't have a really great representative sample from the surveys that you're sending out.
Sorry, Deb, on that note, I actually wanted to mention one more thing, which actually came from Nicole from Durham. So Nicole, feel free to jump in if you're still with us. But she mentioned maybe giving, especially in a remote environment, right? Maybe taking some time within the actual workshop or a program that's being delivered online, the first 5 minutes, kind of like you did with us, Debbie, to do a check-in, maybe over the chat or maybe through the Zoom poll. And so you can try to do something a little bit more, you know, pre-post that way. Certainly making use of that tool and also making use of that time to try to see if there's better uptake. But I went to Nicole.
Yeah, I've heard quite often, once you let go of a client or a youth or a student, it's hard to get them back. And so reducing the number of touch points, not only from a data perspective, but also from a service provision perspective, is really important. So we just need to think about, you know, if they go away, the likelihood of them completing anything decreases for sure. Anything else anybody wants to share or ask?
I have a little bit of a curiosity. I mean, I spent a number of years on a post-secondary campus doing evaluation and research work focused on primarily student engagement. So I wasn't doing it in terms of the student wellness counseling environment. But more recently, I've been getting into working in a therapeutic setting as a practitioner, but it's a private therapy clinic. So there's no rigor or proper procedure to say, like, we have to go through certain steps of doing certain evaluation forms or intake forms. It's really kind of subjective up to each of us as clinicians. And I'm wondering what the common experience is on the campus environment for students who finally maybe make the decision to say, I need to talk to someone. Like, how much of an initial process is there with saying, okay, if you want to talk to us, you have to go through all these checks and balances before we can actually engage in a process. I'm assuming there's more rigor and rules around it than in the environment I'm working in that capacity.
Hey, Chris, I just wanted to actually make a comment, and thank you, Deb, and everyone for today. I'm one of the mental health nurses at Durham College, and we're thinking of running some groups. So the breakout session was really helpful because there's, you know, obviously other institutions that have ran groups, even just finding out things like, you know, keeping data as part of the clinical record as well as quality improvement record, like, and, you know, that need to not necessarily have REB approval. So I'm very new to this, and I would kind of love to know more about the ins and outs of all of that. Initially, we were thinking, you know, opening it up to any student on campus versus, because it's out of our health center, should it just be patients that, you know, as a nurse, I've triaged and referred to this program. So those are all, we're kind of in the very early stages of development. And happy to have an external partner that's already doing groups in the community to be jumping on board as well. So yeah, if anybody has any sort of information about this, or if they're new, or if they've, you know, started a group and have info on that, please email me and I will gladly take any information.
I was part of Marta's group actually, and we were talking about what you need to put into place. You don't need to get REB approval. You can just simply incorporate different kinds of measures in your sort of patient protocols or patient flows. So it's not uncommon to have students complete kind of a presenting concerns form at the beginning, and then you could use outcome measures along the way, whether that's session by session or pre and post. But you don't need REB approval unless you want to actually publish that data and report it out.
Thank you both for following up on my initial question. I appreciate that. And it also sounds like there might be some interest, and I'm happy to send a follow-up email with some information about potentially organizing some type of periodic community of practice for people to connect and actually discuss what is and what isn't working. I know it's something we've internally discussed as part of potentially in addition to our evaluation champion initiative that Deb, I know and Sandra, you're both very familiar with. but in some way, shape, or form, keeping this alive so that people have maybe more opportunities to check in between institutions to see how things are going. So I'll send a follow-up email and gauge interest, and maybe I'll include a little brief survey. And if anyone wants to send some feedback or some ideas of how that could look, would love to hear it.
That's great. Well, thank you everybody for being a part of this today. It's so awesome to see a lot of familiar faces. Missed everybody being in person for sure, and continue doing the great work. And you can always reach out to myself, CICMH, and each other for support. We shouldn't be doing this alone. A lot of us are doing lots of the same things. So let's learn and use each other for that help. So thank you everyone, and have a great afternoon.
Thank you. Bye, everyone.
Bye.
Thanks, everyone. Good to see you all.